stem cells, what true stem cells are, and what you had in New York was probably either exosomes or amniotic fluid or something. So exosomes are basically like, so think of it like if you have chicken soup, and the chicken is the stem cells, and then the soup, the broth has the exosomes. So meaning the exosomes in the broth still have anti-inflammatory properties, nutrients, but there's no actual cells in there. So if there's no cells in there, it can't have those long-term immunomodulatory benefits that we were talking about. So they can be, like you said, they can be anti-inflammatory. It might help a little bit, but exosomes aren't nearly as powerful as actual stem cells.
Welcome back to another installment of Guru Talk. I'm Dave Palumbo, and today is going to be one of my favorite shows I've ever done. I'm joined by my good friend Armon Adibi and Dr. Adeel Khan, who is an expert in stem cell therapies, regenerative medicine, and we're going to find out about a lot of cool modalities. He treated Big Ramy just recently. He's probably most well known for that. Welcome, Doc.
Yeah, no, thanks for having me. I've treated a lot of big names, but Big Ramy was definitely one of the biggest for sure.
He was the biggest size-wise probably that you've treated, right?
Yes.
When you looked at Big Ramy, when he came in, let's start with Ramy since he's the biggest name in the room right now. What did you see? Did you see anything? I mean, when you examined him and he told you what was going on, like what was the, if you can talk about this, what was the main thing that you noticed? You know,
because he talked about it public, like we did post about it, so I can talk about it. And the biggest thing was he was basically saying like he felt like his muscles weren't firing properly, and then he noticed some atrophy. And then he also felt like he was having some areas of pain as well, like near his triceps, and then he noticed some dents in his quads. Like he felt like there was actual defects there. I think some people noticed that as well, right? And so there's a lot going on. I was kind of like, this is weird. There's a lot here, you know. So how do I make sense of this? So I got like basically a full body MRI because I had to figure out, you know, from imaging wise, like what's the root cause here. And his MRI of his spine and his brain, everything came back pretty clear. So it wasn't anything neurological. So if it's not like anything neurological, then it's kind of like, okay, you know, what's really going on? And so to me, based off my experience and everything, I kind of deduced that it has to do with the communication between his cells. For whatever reason, his nerves aren't conducting and firing the way they should be. And it's not a big structural problem because not like he has a huge disc herniation or a mass in his brain or something like that.
Right.
So it's kind of like the process of elimination. And so based off what I understand about intercellular communication and how nerves communicate between one another and how nerves communicate with muscle, why don't they communicate? Why isn't the signals being sent properly? So there's a lot of potential reasons, but by far the most common is inflammation, like chronic inflammation around the nerve, meaning it affects how the cells are communicating with one another. So then how do we get rid of that inflammation? And so that's where stem cells come in. And so of course you can't inject stem cells everywhere, but you can do them intravenously. And so that's kind of how we think.
Yeah, let's stop because I want to go through the process of stem cells in a second. I want to get people caught up, and then we're going to go back to Ramy. But you know, I noticed also when I looked at Ramy, and I said this right from the beginning, I didn't know when you have some kind of a nerve issue with like stenosis or you know impingement, you would see an asymmetry to his body, but he doesn't have an asymmetry. You know, it's like one side is not smaller than the other. So I didn't think it was that. So I'm glad you ruled that out. But I right off the bat said that can't be the issue because there's no way he would be symmetrically losing muscle in the same areas, you know, on both sides.
Yeah, exactly.
So, right. I mean, that makes it. Now, obviously, like you said, how do nerves communicate with nerves with muscle? Obviously, like you said, there could be inflammation inhibiting that, but there also could be obviously a lack of neurotransmitters, you know, theoretically, you know, but that doesn't usually seem to be the case in bodybuilders, right?
Yeah, no, exactly. It's what we understand now. It's kind of like how the immune system communicates with the nervous system. So it's called neuroimmunology, and it's a really interesting field because now we have high spatial resolution. So we're able to see how and why do these communication errors happen. So it's funny because a lot of it actually just comes back to the gut, and because the gut is where 70% of your immune system is. So if you come back to that, a lot of that is where it's rooted in. And of course, people have protocols to restore the gut and stuff, but someone like, Ramy, who's a high level athlete, he needs to get back on stage as fast as possible. So that's why doing the intravenous stem cells make the most sense, because it's going to reduce inflammation around the gut, and it's going to reduce inflammation around the nerves, and it's going to help to restore that communication. And it's funny because after I did that for him, I've had like at least 10 other people who've been like, I have the same problem.
Well, now that you mentioned something, I'm glad you mentioned that most of the nervous system exists in the gut, and a lot of people don't realize that. That's why when you have a serotonin deficiency and they treat you for depression, it's usually because your gut and your digestion is messed up, because that's where all the neurotransmitters are being made. They're not being made up in your brain, most of them, and people don't realize that. So really, there is a lack of neurotransmitters, which is why the cells are not communicating with each other. But what you're saying is it's being caused because of gut inflammation, or maybe even a lack of of stem cells, populations in the gut, maybe, or
their ability to regenerate and repair. They can't repair the intestinal lining, and then that's called intestinal permeability, or leaky gut, as most people have heard it colloquially. So
right. Now, that could be due to an exhaustion of the good bacteria in there, but you're saying it could also be caused by excessive inflammation, right? Exactly.
The principles are all very similar, meaning that chronic inflammation, gut dysbiosis, the ability for like the mitochondria, like there's basically just a few cellular mechanisms that cause most of disease. So that's why once you understand those mechanisms, then you can treat a lot of different problems that other doctors can't. And and that's what, for me, it's not like I don't feel like I'm anything special, but it's just I come back to first principles, and a lot of doctors forget those because they just focus so much on the clinical side, but they don't come back to the foundation.
Why would stem cells fix this problem? What are they doing? Explain to our viewers out there what the stem cells would be doing in Ramy's case here. We know what it does if someone has an injury. We can talk about that, but he doesn't have a specific injury. He has like a diffuse problem throughout his entire body. What are these stem cells doing in your mind, at least?
Yeah. So, to come back to just the basics, like, stem cells basically have the capacity to divide and generate new tissue, and they have the ability to turn into different types of tissue. So those are like the two main properties of stem cells. And there's 4 functions of stem cells that people should understand. So one is obviously regeneration. The other is anti-inflammatory. The other is immunomodulatory, and then the other is antifibrotic. So antifibrotic means it helps with scar tissue and helps to get rid of scar tissue. That's what it means by antifibrotic. And so basically, if you're thinking about those 4 functions, what are we trying to do in Ramy? We're trying to restore his immune system and his nervous system to communicate properly, and so that the nerves fire properly. And so because they're anti-inflammatory, they're going to help with the gut, they're going to help with the inflammation. Because they're regenerative, it's going to help his regenerative capacity with any chronic tears or damage that he has. And then because they're immunomodulatory, they're going to help his immune system, and they're going to help systemically with the inflammation, as well as the signaling between the nervous system and the immune system. So you're kind of looking at all the different mechanisms as how we're going to restore function, that, like you said, diffusely in his whole body. So it's not just localized injection, it's intravenously, and it's going to go out throughout the whole body. The single big reason why stem cells are effective is not because they regrow new tissue, is because of immunomodulation. So meaning it changes the signaling environment. So that's why it has such a long-term benefit. That's why people can do one infusion and be permanently better. It's not because they regrew new tissue, and especially in a couple of weeks, that's impossible.
Right.
Like how did he get better in such a short amount? Like I only did it for him like a month, like 6 weeks ago.
Right.
Like,
he hasn't got the true benefits of it, is what you're saying. Yeah.
Exactly. It's still early on, but he looked so much better, right? And everyone was like, how did he look so much better? And it wasn't, the reason is because the immune system, it had that response that happens in the first few weeks, but the regenerative stuff, that takes months.
So what are you I'm sorry. Are you treating only his back or his quads at the same time, or is it all like synergetic, like work together? Like
no, we just did an IV, so it's intravenous. So we didn't even do any localized. He didn't want to do any localized injections because he had a show coming up. And if you do localized injections, you have to take some time off, right? So when he comes back now, the plan is to do some localized injections and then probably another IV as well.
Because I know the motivational speaker. What was his name? Dave, big tall guy. He had 2 infusions. And
Anthony Robbins.
It fixed his neck totally. So
yeah.
Well, I said right after I heard that Ramy had this done, everyone's telling me about Ramy's stem cells. I said, look, there's no way he could have gotten localized injections. I said, because you can't train that area. I know, because I've had stem cells done. They want you to rest the area. So I said he must have had intravenous injections, and I'm assuming he's going to go back for more. And I'm glad you validated that, because that makes sense. So
yeah,
what are more potent, the localized injections or the systemic?
Definitely for injuries and pain, localized is going to be more effective because it's going right in the site. The intravenous does have a homing mechanism, meaning like Tony Robbins, for example, he had neck pain. I don't think he did any neck injections as far as I know, but he just did IV and it got rid of most of his pain. Ronnie Coleman is another example. He did 2 infusions and it got rid of he had pain like everywhere, and he was on God knows how many pain pills, right? And they got rid of most of his pain. So there are people where just like IV can be very effective for pain, but in my experience, like if it's more severe pain, usually you do need to do some localized as well. But for anti-aging and longevity and for general health benefits, the IV is great. And depending on what you're trying to treat too, the IV can treat a wide range of neurological conditions, degenerative conditions. The key, I think, for people to understand is like where are they getting their stem cells from, and like what's the sourcing, and how are they growing their stem cells? And that's kind of the difference. That's why, that's why Ramy was happy that I was here, because he had heard about me and he wanted me to specifically work with him, because he had heard that obviously I do some things a little bit differently than most doctors. But I think the only difference really is on the stem cell manufacturing side is that I know who the best stem cell manufacturers are, because the way you expand the stem cells is so important. So if you don't grow them the right way, the cells can actually become senescent. So senescents are like those zombie cells, where they're just like dead cells, and then they can actually secrete inflammation. So if you don't do it properly, you can actually make yourself worse potentially, or it just won't do anything. So you have to make sure you're working with a good doctor and a good stem cell manufacturer, which is the issue, right? Because there's not much regulation in South America and stuff. And then so you have all these pop-up stem cell clinics promising all these things. And, so there's a lot of, unfortunately, like bad players in this space,
Let me tell you what I had done, and then you could tell me what the difference is between, because I know what you're doing is light years ahead of what I had done. So one time I went, or twice, I think I had a guy in New York because I needed shoulder replacements. I knew the stem cells weren't going to hurt, but I said, but I said, you know what? Can't hurt. Let me try it. They were like these syringes of like a gel-like stuff that it was supposed to be some kind of, I don't know what they were not like from me, because I don't have any fat cells. A lot of times they spin this fat cells down and they get these stem cells. So I got some kind of synthetic, some came from a lab. I don't know what they would sell in the US. I think they were called embryological stem cells. I don't know if that's true or not, but that was injected the first time. I didn't notice anything from it. Okay. Maybe a little anti-inflammation. When I had my ankle surgery recently, the doctor, that's funny. That doctor actually was he believed in taking stem cells out of the pelvis, out of the pelvic bone. And he drew supposedly some stem cells, and he injected it into the area after they did whatever surgery they did on my foot for helping. I don't know if that helps. What is the difference between the stem cells they got from my iliac crest versus the stem cells that they used in that syringe that they must have gotten from a lab versus what you're doing? Explain the nuances and the differences.
And is that a PRP that Dave had done?
No, this was stem cells. Okay. This was stem cells. PRP, I had some PRP too, but this was stem cells though.
Okay.
Yeah, the problem is it's the nomenclature. So basically, like the words people are using to call stem cells is even the right word, which is the whole problem. And I don't think we can fix it because we're beyond that point now. But just for the sake of like this interview, let's say what you had done during your surgery was not stem cells, because even if you take your bone marrow, it's called a bone marrow aspirate concentrate, or BMAC is the short term. So BMAC, as is referred to, is an aspirate of the bone marrow. And so the bone marrow aspirate, yes, it has a small amount of progenitor cells in there, committed progenitor cells, and I'll explain that in a sec, but there are no actual stem cells in there. And moreover, there's actually a lot of other things in there, like growth factors, anti-inflammatory cytokines, and signaling molecules. So really, the BMAC, what it's doing is it's sending signals that reduce inflammation. There's nothing in there that's going to really turn into new cells. All it's going to do is send signals to your own body to perhaps initiate the regenerative process, similar to PRP. So from a perspective of understanding mechanisms, BMAC is more similar to PRP than it is to stem cells. But most doctors don't understand that. So they're going around saying, we're going to do stem cells. We're going to take some fat. We're going to take some bone marrow. We're going to get stem cells. They're going to be great. But those aren't stem cells. They're called committed progenitor cells, or medicinal signaling molecules. The guy who coined the term, his name's Dr. Arnold Kaplan. He's a friend of mine, and he always gets so annoyed. He speaks at conferences, and he actually wrote a whole paper. He actually wrote a whole paper in Nature in 2017 about please stop calling them stem cells. The doctors don't, I guess they don't read, but they just keep doing things.
Yeah.
And so they keep on regurgitating from one another, but it's nothing. But there's actually no stem cells in there. They're anti-inflammatory cells and signaling molecules. Now, stem cells, what true stem cells are, and what you had in New York was probably either exosomes or amniotic fluid or something. So exosomes are basically like, so think of it like if you have chicken soup, and the chicken is the stem cells, and then the soup, the broth has the exosomes. So meaning the exosomes in the broth still have anti-inflammatory properties, nutrients, but there's no actual cells in there. So if there's no cells in there, it can't have those long-term immunomodulatory benefits that we were talking about. So they can be, like you said, they can be anti-inflammatory. It might help a little bit, but exosomes aren't nearly as powerful as actual stem cells. So now what are actual stem cells? So that's where you actually isolate the stem cell from the bone marrow or from the fat or from the umbilical cord. So there's many sort, or even from the dent. They can take it from teeth now. They can take it from urine. They can take it from so many different places. There's stem cells all over, right? And so that's where you actually isolate it from a specific tissue, and then you grow it in a lab and you expand it. And then you can have, 1 million, 10 million, 100, 200 million, whatever dose you need. And then you can actually inject it or put it IV. So you have to isolate and expand. And if you aren't doing that, and that's illegal in the US, so hence.
Why is that illegal here?
FDA's 70% of their funding comes from pharmaceutical companies. So it's in their best interest to regulate stem cells as a drug, meaning they want it to be highly rigorously regulated. So it's really hard to get approval. When in fact, it should not be regulated like a drug because it doesn't have the same harm as drugs do. There's very little harm and there's so much benefit. So in fact, it should be regulated like a medicinal or naturopathic treatment, like
Synvisc would, like that you inject into the
exactly, exactly. Like Japan is a perfect example. So I'm going to Japan in a few weeks because they're like one of the leaders in the world for stem cells, and I'm doing some work there. But so Japan had an act on regenerative medicine in 2014. So that they've been regulating and approved stem cells for almost a decade. And the US and Canada, we can't even get our act together to even do anything. Like it's just corruption and politics. It has nothing to do with science. The Japanese and the Chinese are so far ahead of us with stem cells. It's crazy.
Wow. So what have you seen so the stem cells, what do you buy them from, a lab? Is that what you do?
I make sure I partner with good stem cell manufacturing people. Like, so I've chosen like particular scientists. I have a few I work with in the US and a few I work with here in this side of the world. And I check the quality control and how they do it and all that stuff. And then I make sure, and then those are my suppliers that I use. But I'm working with University of Toronto, and we're actually working on making our own stem cells using some gene editing and enhancing them. But that's like the next generation tech we're working on.
Oh, cool. Yeah. So, but I mean, when you call up the place where you would buy them from, what do you like if you all right, I got to work on Big Rammy. I need 20 billion stem cells. How do you order them?
Exactly. That's literally what you say. You're like, I need like 400 million stem cells because he's a gigantic man.
Yeah.
So
and then they prep it. Yeah.
And you put it in an IV bag? Is that how they get them in this body? Oh, cool. Yeah. All right.
So to clear this up, anybody that says in the United States, I'm having stem cell done is not actually having stem cell, correct?
Unless they're getting it done illegally, which some people do, but then you should be questioning the doctor you're working with.
Exactly.
Because there's so many clinics that are saying, I'm doing stem cell, and so many people just, okay, here's whatever, $1,000. I had a nurse I was training, this was probably 7 years ago. Brian Dobson, owner of Metroplex Gym, he's having a shoulder. She's like, well, they do stem cell there. They take from your hip, like what Dave had. And he spent a crazy amount of money there and did absolutely. They were saying his shoulder was bone on bone. And they were saying, oh, we can regrow it. And he just spent a bunch of money.
I told him to get the replacement. I warned him about that.
Yeah. I mean, I've treated bone on bone, but I'm one of the only doctors in the world, but I learned this from a guy in Spain. And basically, what we do is we inject the expanded stem cells into the bone, and then we inject into the joint. Because the problem with osteoarthritis is that it's not just the cartilage, it's what's called the subchondral bone underneath that gets inflamed and damaged. So there's actually a study in France that did the intraosseous stem cell injection. It's called intraosseous. And they actually showed that 12 years after, patients were still doing well. So it can have long-term results even for bone-on-bone or end-stage osteoarthritis, but it's just a technique. And no doctor, and like there's like maybe 5 doctors I can count on my hand who know how to do that in the States. And then plus they're not using the right type of stem cells.
How do you inject into a bone? That's what I'd love to know.
I have strong hands, so I can.
You could actually force a syringe into the bone and push stuff into it.
It's a sharp needle. You can use a drill too, but I actually found that it's just torquing. It's just torquing. Don't worry. We put you to sleep, so don't worry. It's not that.
Oh, okay. All right. That's crazy.
So I heard what you said on Peterson's show.
Armon, I'm acting like I'm worried about it. Meanwhile, I had the head of my humerus cut off and a big spike stuck in there, and I'm complaining about a needle going into the bone, right?
Right. So, Dave, what did you have PRP done on?
I had PRP and the stem cells, which were obviously I'm finding out now were not stem cells, into my shoulder, both shoulders I had done, and then they did follow up PRP for 3 weeks in a row following the stem cell injections, but. Like I said, it didn't do anything for me. I do know some people who what?
Yeah. No, I was just gonna say PRP. It's an older technology, but we do still use it sometimes for muscle tendon tears and stuff, and it works great. But again, there's no regulation, so you just have people just making up their own PRPs. Like you don't know what's in there.
People do it in their house. I know a guy who does it in his house. He spins his own blood.
How do they spin? Yeah, it's like how do they spin it? How long? Like what temperature? There's so much nuance to it, right? And these guys don't understand. Like I was lucky. I was trained by the guy who actually invented PRP. His name's Dr. Gallia. He was the first one in the world to do it. He did it for Tiger Woods and like all these guys. So, but like he's like he just shakes his head at what he sees now, right? So
I don't think PRP is anything miraculous. Like I said, it's good if like you have like he said if you have like a tendonitis or like an inflamed area, but people think it's going to, fix their knee that is ready for,
There's no building blocks. There's no building blocks in there, right? All it is working with your own body to send signals. And so, unless you're young and healthy, those signals aren't going to be that great, and it just wears out.
Yeah. In 2002, I think it was, or one of the, I think it was 2002. There was a place in Miami Beach, right on Collins there, that did this, I guess it was like Prolotherapy. He didn't call it that. He was like, sugar solution with growth hormone in there, which I never understood why growth hormone injected into my shoulder was going to do anything. He was really expensive too, but I went there. I was willing to try anything. I was still competing at the time. And there was a whole bunch of other stuff they put into this thing and injected into my shoulder. He did like every day for a week. I was there in Miami and I don't know, it felt a little better for a little while. I don't know if it was just placebo or what, but there's been my point is there's a lot of people doing a lot of wacky things. And what you're basically saying is most of these things don't work, right?
And that's the problem, right? Is people are spending money and just getting false hope. And there's no, the regulation is like, it's not proper in the US. So you have this black market almost of people just offering all these weird things. Yeah. And then you just don't, people are desperate. And then so they, they trust their doctors to know their stuff. But unfortunately, doctors, a lot of them are just, they're humans and they just want to make money, a lot of them.
So I had PRP done I've had it done several times and it actually did a lot. I believe it did a lot for me. So I had it done and I heard you talking about on Peterson. It's like something that's so old, like 5 or 6 years, ago it was something, but now, we're so far behind in technology here. My knees, I could barely bend down for like almost the last year. I mean, I went to a pain specialist for my back years ago. They got me on a nice little oxycodone addiction for about 4 years instead of, and that was bad. And so, I got I got my knee MRI'd and it was okay, but both the knees, I just couldn't squat, even a body squat. And so I went to my friend, he's a doctor here. He does PRP and he only charged me pretty much for the kit. He's like, some doctors charging like $3,000 for PRP, something crazy like that. I did both my knees. And then 3 weeks later, the pain was gone. And what is that? Is it just from I'm just healthy? Was it just a little maybe arthritic? The MRI showed that it was clear, but the pain was. I mean, for the last year,
anti-inflammation, I'll bet you, right?
Yeah, exactly. It's just anti-inflammatory.
Okay.
Which is still helpful in your case. Obviously, inflammation was a problem. But when did you have it done?
What's up?
How long ago?
I had about 2 months ago, and within 3 weeks, I felt like it did something. Is that even too fast?
Well, my only concern with PRP, at least for inflammation, is how long it's going to last. And hopefully, it won't. Maybe if you do the biomechanic stuff, you do some good therapy, it won't come back. But in a lot of cases, it does come back, and then that's where it's like you keep shooting yourself up with PR. And there are some people who do PRP every 6 months or a year. But then that's where it's like, why am I doing an inferior technology if I could do something like stem cells and I'm good for like a decade or something, you know?
Right. And you know what? The standard orthopedic surgeon that I go to, you know, around here, they'll give you God forbid you asked them for a testosterone replacement prescription, they would go crazy, but they'll give you a cortisone shot every single time you come into the office. And I'm like, I don't want it. They're like, oh, just take it. You're going to feel a lot better. I'm like, I don't want cortisone. It's going to make it worse. I said.
It without a doubt makes it worse. It's again, mainstream media is finally picking up on this stuff, but NBC just published an article a couple of months ago about how one cortisone injection can accelerate the progression of osteoarthritis. So it's like, what are doctors doing when they're bringing patients back 3 times a year, 4 times a year for cortisone? Yep. And then they're also putting what's called Marcaine, which is like, it's also toxic to cartilage. And so you're literally just setting them up for surgery. That's all. It's a system that's designed to feed itself. Yep. And it's designed on that way on purpose, unfortunately. The American College, the American Association, AAMC Medical College, they designed the system to be profitable. So they didn't design it to be in the best interest of patients. That's just the reality of it.
All right, so look, I'm falling apart at 55 years old. I have an ankle that was just fused. I have 2 shoulder replacements that, knock on wood, feel great right now, so I'm not going to jinx myself on that. I had my thyroid removed 2 years ago because I had thyroid cancer. I'm getting heart surgery, which we talked about. I'm having my aorta fixed. I have an enlarged aorta, and hopefully they won't touch the valve. I recover from my surgery, let's say, 3 months later, I say to you, Dr. Khan, what could you do for me to help me heal from whatever I had done and then maybe prevent some future stuff from happening? What would you do to Dave Palumbo?
Yeah, no, for me, from a regenerative medicine side, it'd be a no-brainer to do the intravenous stem cells. It's gonna lower your cellular. Your body's probably aging at a faster rate than it should be, just because for whatever reason. And so, this is where it can slow down the aging process, and then it can also reverse some of the damage as well. And it's something for someone at your level who's had it a lot. It's probably something you do every 1 to 2 years, and most people notice a benefit in terms of energy, recovery, sleep. Mood, concentration, like lots of different things. Like I always like to give that story of the NHL player we had who was like 35 and he was like thinking of retiring, and then he did the IV, and then like 6 months later he said he felt like he was 25 again. He's not going to retire. Wow. So it was like amazing, right? It's like you're extending people's career, and these guys are multi-million-dollar athletes, so for them it's like a no-brainer, right? And so it's just because at the end of the day it's just money. Like for them that's not a big deal, right? But
You know what it is also, like, I go to the chiropractor and I try to do I try to eat right. I take supplements. I do everything. You can't do it. I always tell people, I don't worry because I try to do everything right, and I can't do anything more than I already do. But, I go to the chiropractor, they take an x-ray of my spine and it comes back. They're like, oh, your spine is horrendous. And meanwhile, my father had like degenerative spinal stenosis when he was older and he was in a lot of pain, and his mother had it. And I'm thinking, great. I feel good now, but my spine looks terrible. I don't know why. I mean, I'm assuming the muscle I have is kind of supporting it. So I'm thinking, I got to do something proactively now. And I'm sure a lot of people in my situation, at my age range, are thinking the same thing. How could I proactively prevent future issues or future problems from happening? And you're saying doing stem cells, how frequently is something that will
exactly. Be good? So why does your body age in the first place? So it's because we know now there's like about 8 or 9 hallmarks of aging. They're called epigenetic alterations. They don't have to do with your genes, but they have to do with how the environment over time affects the gene expression and the protein and the expression of those genes. And so you've probably heard of methylation, which is one of the epigenetic. That's how you measure biological age, but it's only one measure. And so you have to look at multiple different epigenetic alterations. So there's actually a test. It's called HeLiSafe. It's out of Italy, and they look at multiple epigenetic alterations. So it's the world's first test to actually kind of look at a comprehensive cellular aging test. And so the idea is you're aging because your stem cells are exhausting. So it's called stem cell exhaustion. That's one of the hallmarks of aging. So the quality of those stem cells and the number is going down significantly. Right. Just to give you a frame of reference, when you're a baby, you have like 200 million stem cells per cell, and by the time you're 80, you have like 1 million. So that's a huge decrease, right? And so
well, let me stop you for 1 second. I don't mean to interrupt you, but as bodybuilders, because we break down so much muscle tissue, and we know that stem cells are used to remodel muscle, especially when we have hypertrophy going on, are we exhausting our stem cells more at a much more accelerated rate than the average person who doesn't work out?
I don't think anyone's done that study, but I would, if I had to, if I had to guess, I would say yes. From a basic science mechanistic point, it makes sense because especially because you're breaking down your body and your body is going to be using more stem cells to keep rebuilding, building. Yep. So I think you're definitely going to be depleting, and that's why it makes sense that your whole body is aging at a faster rate, because stem cells are one of the biggest reasons to keep your body from slow down aging.
Could that be why, as a lot of bodybuilders age who've been competing their whole life, they start losing muscle and they don't know why? Especially we notice in the legs a lot.
Exactly. Yeah, it's because you don't have those protective mechanisms, and it's all about cellular aging, right? So we talked about stem cell exhaustion, but there's mitochondrial dysfunction, there's genomic instability, there's chronic inflammation, there's all these hallmarks of aging that happen at a cellular level. And so can we slow down those epigenetic alterations? And the only way I know from obviously there's lifestyle, like muscle probably is one of the best ways. Obviously muscle is very protective because muscle is like an organ, right? It releases something called myokines, which are little signaling molecules that go around your body. They reduce your risk of cancer. They have all these benefits. And then everyone, like you said, most people understand about like sleep, stress, exercise, nutrition, all that stuff, right? So most people understand the basics, but then it's like, how else can you keep your cells healthy? And I think intravenous stem cells have that kind of golden spot in the sense that they're going to affect all those different hallmarks of aging. They're not going to just affect one. Yes, they're replenishing your stem cells, but they're actually having what's called pleiotropic effects, which means they're having multiple effects on the cellular level. So they're going to affect the mitochondria, they're going to affect the inflammation, they're going to help make your genes more stable, decrease your risk of cancer, like all these different things. So it's pretty amazing. That's why it's a pretty cool thing if you're thinking about it. It's like you're taking babies' umbilical cord stem, like literally a fresh baby, and you're taking their stem cells and you're putting it through your body to make yourself younger. So, I mean, from a very intuitive perspective, like you can understand that. It's like if I take someone who's younger than me and I take their stem cells and put them through my body, it's probably going to make me better.
Now, having said that, why is it that when you take stem cells from one person's body, okay, and you multiply them, you don't have to worry about the body rejecting these stem cells? Because a lot of people ask that question.
Yeah, because we're isolating what are called mesenchymal stem cells, MSCs, and MSCs don't have an antigen, so there's no HLA antigen, so there's no protein that's going to cause immunorejection. So they're immuno privilege. So meaning MSCs can go through your body and you don't have to match. That's why like 20 years ago, I don't know if or whatever, like some people might remember, they used to be like, oh, do you want to store your stem cells? Like you should keep them for later when you're, when you get birth. Right. And then because maybe your kids will need them down the road or something. But that was because we used to think that like you had to match to your parent or whatever. But now it's not. Now we know that's not the case anymore. So you can use anyone's stem cells and they're immuno privileged. It's different from.
I think they have you store. They ask you. I know because when my kids were born, they wanted to know if we wanted to store their cord blood, the umbilical cord blood, because in case like they ever needed like a bone marrow transplant. I think that was that has to be matched, right?
Yeah, bone marrow transplant's different because it's not just the MSCs. It's called the hematopoietic stem cells, HSC, different types of stem cells. So that's why it's important to understand that for that you need matching. Yeah.
Right.
So like they took when we had our kids, they took the umbilical cord. So that can't do anything for us. Like we both have kids. Is that just for them in case something that happened to them or us also?
Well, in the U.S., you can't even use them. So,
so what does somebody do? Okay, like the average, like for me right now, I'm suffering from. I've had herniated disc in my neck and lower back for 10 years now. Up until the last year, the only thing I've changed, I stopped getting cortisone injections, which is poison, right? But the last year, my calves have been atrophying tremendously. They used to be huge, big, full. Of course, I can work them out all day. And the inner calves are atrophying. I have a herniation. I forgot what disc actually. But what does someone like me do until I can make it to Dubai or Mexico?
You mean until you can make it to there?
Right. Like what does someone like me do? Yeah.
You suffer, Armon.
No, well,
do the Band-Aids, the steroid injections?
I mean, I think peptides can be a good bridge potentially. So peptides, most people understand insulin. Like insulin's the most famous peptide, right? It's just a chain of amino acids. It's a protein. It sends a signal to your body. So now we have designer peptides, right? We have like designer ones that can help with regeneration. They can help with gut inflammation.
Do you believe in those, the BPC and the TB 500?
If you get the good quality, but the problem is most manufacturers, again, are, shit. Like, so you have to use a good, I only trust one guy, and his name's Gene from Montreal, and he's Can Labs. Like, he's the only guy I know who's reputable, and like all the top guys I know use him. And he's a Canadian manufacturer, so like Canada has really high standards in general when it comes to manufacturing. So he's the only guy I trust with that stuff. But basically, those molecules can work, and there's a lot of research on TB4 or TB500, as it's called thymosin beta 4 or TB500, and that's one of the best studies. Yeah, so it's basically what it does is helps to modulate your immune system. And like we were talking about before, the immune system is intimately related to your central nervous system. So if your immune system and central nervous system are not communicating, or just dysfunctional communication causing chronic inflammation, then that's going to cause the nerves not to communicate, and then you get the atrophy and all those other issues. So if you take TB4 and BPC 157 and maybe the TA1 as well, thymosin alpha 1 for your immune system, it might have a bit of effect. So that's something you could try on, to see. Obviously, I'm not giving medical advice, but these are just things you can try at home, And
I tried a little of the. I alternated from Titan. Titan Medical is one of our website sponsors. They have some really great products, and they have them all made in the United States, compounding labs. And I used some of their TB4 and the BPC 157 when I was healing my ankle, and I did feel a difference on them. So I don't, once I started using them, I noticed.
Yeah, I think U.S. manufacturers are good. Just a lot of them are Chinese manufacturers, and that's where.
They make it in the U.S. from one of the labs here. That's when people ask me, hey, I can get it real cheap on these websites, these peptide websites. I'm like, no, there's no regulation of those. I'm sure it's coming from China. No one knows if they're being made right or not. And so.
Yeah, exactly. So I think with that and like good exercise there, like if you can find a good movement therapist, like a lot of times they can help too. And there's something called, I've been learning it from in this part of the world. It's really cool technology. It's called Immuno Neurofrequency. But if you look up ANF practitioners, some of them actually, they use this really cool, these little patches. And they're these little patches that it's like NASA technology. And basically what it does is it helps with nerve communication. So hence the name Immuno Neurofrequency, because it's basically sending signals at a certain frequency to help with communication between cells, and it can help with inflammation and pain. So it's a cool technology. I'm not an expert in it, but at least if, like you were saying, what else can you do besides just stem cells? ANF is really cool, and there are a lot of people where it's helped them and changed their life in terms of pain and stuff.
So I'm in Dallas. I can just Google that, and I can find a provider probably in the Dallas area and that's what I should.
And I think ANF and peptides together can help a lot of people, and then maybe they don't need the stem cells that way, right? So I'm always like the last resort for like everyone I see. It's like they've like seen everyone.
I'm sick of getting old, Dr. Khan. I'm sick of it. I need some stem cells. I need a lot of them. I need big Ramy dosages of stem cells at this point.
Me and David are just going to come out and stay hooked up for.
Yeah, I think we're going to go to Dubai after my surgery's over. I'll have to time it with a bodybuilding show there. I think, don't they have that Dubai Classic sometime in like December or something like that?
Oh yeah, they do. Yeah.
What?
No, I was saying I'm only here temporarily anyway. Like I'm going back. My plans to be based out of Toronto and Florida most likely. So that'll be my home base.
Yeah, but you can't do the cool stuff in Florida though, right?
No, you come down to Mexico or Dominican, wherever. We'll be set up. We'll have a few offers.
Yeah, at least set up a place that I can make a vacation out of it. So I can.
Where in Mexico are y'all at right now?
Exactly. Yeah. Exactly. No, well, we're in Cabo.
Cabo? Okay.
We're at Cabo in Mexico.
We could do Cabo.
Like it's like a resort. Like it's all like hotels there. Nice. Yeah, Cabo's really nice.
I got to talk my wife into it to bring the kids down to Cabo, get a little vacation out of it. All right. Well, I really appreciate you taking time coming on the show and kind of filling people in. If people do, let's say there are some people out there that need your services right now and they want to go to Dubai, what's the best way to get in touch with you? Hello, I think we lost you there for a second, Doc. We can't hear you.
The best way is definitely Instagram. I'm very active on there.
Okay.
So if they just look up.
What's your Instagram account? You did so well the whole interview. Now
I know it's muting you now. We can't hear you right now, Dr.
What's your Instagram account, Doc? I think we lost him. Yeah. No. Oh, yeah. I think I found it here, Doctor. Let's pull up your account right here so we can show people.
Yeah, because for the last minute we haven't been able to hear you at all.
Yeah, we haven't heard.
Let me just see here.
Yeah.
Okay.
Oh, there you go.
I think
there's your account.
Yes, at dr.acon.
Yep, there it is. Pulling it up right on the screen here. I just followed you, and you get the big Ramy here talking about his little experience there. And people want to contact you, just key him on Instagram. He'll get back to you quickly. Dr. Khan, thank you for joining us today. I really appreciate it. You really enlightened us and gave us a lot of great information. And I will at some point be absolutely under your guidance and your needle, so to speak, because I need stem cells, real ones.
Yeah,
thanks so much. Yeah, he's breaking up, but we'll be in touch. And once again, if you guys want to reach out to him, check out his Instagram. For now, I'm Dave Palumbo with Armon Adibi, Dr. Khan. We'll see you next time for another installment of Guru Talk.